Hi everyone, this is Dr. Devin Barley with Greenwich Chiropractic, and we are talking about low back pain in this video series. We're actually in our diagnostic imaging suite where we take x-rays. And a lot of people will ask, why do we take x-rays? And really the saying is, to see is to know, to not see is to guess, and we're never gonna make guesses when it comes to your health. Now, at this point, you've already had some testing done, some orthopedic testing, so that we can determine if x-rays are appropriate. And the things that x-rays can show are so important. We can see things like disc degeneration, if the discs are starting to degenerate and pinch the nerves. We can see things like acute fractures or dislocations, if it's been something like a slip or fall or acute trauma. And we can also see things like bone spurring or arthritis. And in that way, we do two things. Number one, we're able to effectively, more specifically diagnose the problem, as well as manage it effectively. So this is why x-rays are vitally important when it comes to taking care of you, because we want to make sure we're doing the absolute right thing for you. Another question people have is x-ray radiation. Now, the last study that they did on the amount of radiation that x-rays put out was done in the 50s, and what we find now is that the therapeutic dose is so low when it comes to radiation that the diagnostic benefit completely outweighs any excess of a little bit of radiation that you may get. These new machines are amazing, and the great thing about them is they're digital. So as soon as we take the films, we can see them right away, so that on your first visit, we can decide what we're gonna do. That is why we have x-rays in the office when it comes to your low back pain, if we deem that it's necessary, so that we can understand the underlying problem. And by showing it to you and taking you through that process, we can also give you tools outside of the office to be able to prevent this in the future. Thanks so much for listening. We'll see you on the next video.